There is a health condition that affects nearly every man who lives long enough. By age 60, over half of all men experience it. By age 85, that number rises to 90%. It disrupts sleep, causes embarrassing symptoms, and significantly impacts quality of life. The condition is benign prostatic hyperplasia, commonly known as enlarged prostate. For decades, the pharmaceutical industry has offered medications that work, but often come with unwanted side effects: sexual dysfunction, dizziness, fatigue. But in the swamps and coastal plains of the southeastern United States, a small palm tree produces berries that have been used for male health for centuries. Native American tribes knew about it long before modern medicine existed. European doctors began prescribing it over 100 years ago, and today it remains one of the most popular natural supplements for men's health worldwide. This is Serenoa repens, the Saw Palmetto, and the science behind it is far more complex than most people realize. The Saw Palmetto has a history intertwined with the native peoples of Florida and the Gulf Coast. Seminole and Miccosukee tribes consumed the berries as a food source and medicine for generations. They used it to treat urinary problems, reproductive issues, and general weakness. Spanish explorers documented its use when they arrived in the 16th century. By the late 1800s, American physicians had incorporated Saw Palmetto into their medical practice. It appeared in the United States Pharmacopoeia, the official list of recognized medicines. Doctors prescribed it for urinary tract infections, prostate problems, and even as a general tonic. The early 20th century brought a shift toward synthetic pharmaceuticals. Herbal medicines fell out of favor in American medicine. Saw Palmetto disappeared from mainstream medical practice for decades. But in Europe, particularly Germany and France, research continued. Scientists began systematically studying the berries and their effects on the male reproductive system. What they discovered brought Saw Palmetto back into the global spotlight. Saw Palmetto is a small palm tree belonging to the family Aracaceae. It rarely grows taller than 10 feet, usually forming dense clusters of fan-shaped leaves. The name comes from the sharp, saw-like teeth along the leaf stems that can easily cut skin. The plant is native to the southeastern United States, thriving in sandy coastal soils from South Carolina to Mississippi. Florida contains the largest wild populations, particularly in the scrublands and pine flatwoods. Saw Palmetto is remarkably hardy, capable of surviving wildfires, droughts, and hurricanes. Some individual plants are estimated to be over 700 years old. The medicinal value comes from the berries, which ripen from green to dark purple-black in late summer. These olive-sized fruits have been harvested commercially since the 1990s. Wild harvesting remains the primary source, though some cultivation efforts have begun. The berries contain a complex mixture of fatty acids, plant sterols, and other bioactive compounds. Fresh berries are dried or processed into extracts for supplement manufacturing. The chemistry of Saw Palmetto berries centers on several categories of compounds. The most important are fatty acids, which make up 80 to 90% of the lipid extract. Lauric acid, oleic acid, myristic acid, and palmitic acid are the primary fatty acids present. These fatty acids are not ordinary dietary fats. They appear to have specific biological activity related to hormone metabolism. The second major category is plant sterols, particularly beta-sitosterol. Beta-sitosterol has documented effects on prostate tissue and urinary function. It appears in numerous studies as an independent treatment for prostate symptoms. Saw Palmetto berries contain significant concentrations of this compound. Additional components include flavonoids, polysaccharides, and high molecular weight alcohols. Scientists believe the therapeutic effects result from multiple compounds working synergistically. This complexity makes Saw Palmetto difficult to study using conventional pharmaceutical methods. Isolating a single active ingredient may miss the combined effect of the whole extract. Most clinical research uses standardized lipid extracts containing specific percentages of fatty acids and sterols. The primary mechanism of Saw Palmetto relates to hormone metabolism in prostate tissue. To understand this, we need to examine how the prostate grows and why it becomes problematic. The prostate gland sits below the bladder and surrounds the urethra. Throughout a man's life, it continues growing slowly under hormonal influence. The key hormone driving this growth is dihydrotestosterone, commonly called DHT. DHT is created when an enzyme called 5-alpha reductase converts testosterone. DHT is significantly more potent than testosterone in stimulating prostate cell growth. As men age, accumulated DHT exposure causes the prostate to enlarge. This enlarged tissue squeezes the urethra, restricting urine flow. Men experience frequent urination, weak stream, nighttime waking, and incomplete bladder emptying. Pharmaceutical treatments like finasteride work by blocking 5-alpha reductase. Less enzyme activity means less DHT production and slower prostate growth. Saw Palmetto appears to work through a similar mechanism. Laboratory studies show that Saw Palmetto extract inhibits 5-alpha reductase activity. This reduces DHT levels in prostate tissue. Additionally, Saw Palmetto may block DHT from binding to androgen receptors. Even if DHT is present, it cannot stimulate growth if it cannot attach to cells. Some research suggests anti-inflammatory effects as well. Chronic inflammation contributes to prostate enlargement and symptoms. By reducing inflammation, Saw Palmetto may provide additional symptomatic relief. The combined effect of these mechanisms could explain why many men report improvement with Saw Palmetto supplementation. The pharmaceutical story of Saw Palmetto is primarily European. German and French researchers conducted rigorous clinical trials throughout the 1980s and 1990s. Based on this research, European regulatory authorities approved Saw Palmetto extracts as prescription medications. In Germany, Saw Palmetto extract is sold under brand names like Prostate and Sabal. Doctors commonly prescribe it as a first-line treatment for benign prostatic hyperplasia. The German Commission E approved Saw Palmetto for urinary symptoms associated with prostate enlargement. In France and Italy, similar prescription products are widely used. European physicians often prefer Saw Palmetto because of its favorable side effect profile compared to pharmaceutical alternatives. The American medical establishment has been more skeptical. The FDA classifies Saw Palmetto as a dietary supplement rather than a medication. This means it cannot be marketed with disease treatment claims. American urologists generally do not recommend Saw Palmetto, citing inconsistent clinical evidence. However, millions of American men use it anyway, spending hundreds of millions of dollars annually. The disconnect between European medical acceptance and American skepticism reflects different regulatory philosophies and evidence interpretation. Beyond prostate health, Saw Palmetto has gained attention in the hair loss industry. Male pattern baldness shares a common cause with prostate enlargement. DHT attacks hair follicles in genetically susceptible individuals. The hormone causes follicles to shrink progressively until they can no longer produce visible hair. The pharmaceutical treatment finasteride works by blocking DHT production. It is effective but carries risks of sexual side effects that persist in some men even after stopping the drug, because Saw Palmetto also inhibits 5-alpha reductase. Some researchers hypothesized it might help with hair loss. Several small studies have examined this possibility. Results have been mixed, but generally positive. One study found that 38% of men taking Saw Palmetto showed improved hair growth. Another found it comparable to low-dose finasteride. The hair loss supplement industry has embraced Saw Palmetto. It appears in countless products marketed for thinning hair. However, the evidence is not strong enough for dermatologists to routinely recommend it. Men using Saw Palmetto for hair loss should have realistic expectations. Any effects are likely modest compared to pharmaceutical treatments. Saw Palmetto extract is used in some cosmetic formulations. The anti-androgenic properties have potential applications for oily skin and acne. Excess sebum production is driven partly by androgens. By reducing androgen activity, Saw Palmetto might help control oiliness. Some skincare products marketed for acne-prone skin include Saw Palmetto extract. The evidence for topical effectiveness is limited. Most research has focused on oral supplementation rather than topical application. Hair care products also incorporate Saw Palmetto. Shampoos and topical treatments claim to reduce DHT at the scalp level. Whether enough active compound penetrates the skin to produce meaningful effects remains unclear. The cosmetic industry often makes claims that exceed the scientific evidence. Consumers should approach Saw Palmetto cosmetic products with appropriate skepticism. The global market for Saw Palmetto products represents a significant industry. In the United States alone, Saw Palmetto supplement sales exceed $100 million annually. It consistently ranks among the top 10 selling herbal supplements. The European pharmaceutical market adds additional hundreds of millions in sales. Germany, France, and Italy represent the largest prescription markets. The hair loss industry contributes further demand. Combination products targeting both prostate and hair concerns are increasingly popular. Wild harvesting of Saw Palmetto berries has become a substantial business in Florida. Harvesters collect millions of pounds of berries each season. This has raised sustainability concerns. Overharvesting, combined with habitat loss, threatens wild populations. Some conservation groups have called for harvesting regulations. Commercial cultivation efforts are expanding, but can't yet meet market demand. The supplement industry also faces quality control challenges. Testing has revealed significant variability between products. Some supplements contain far less active compound than their labels claim. Consumers should select products from reputable manufacturers with third-party testing. The scientific research on Saw Palmetto has produced frustratingly inconsistent results. European studies from the 1980s and 1990s generally showed positive effects. Men with benign prostatic hyperplasia reported improved urinary symptoms. These studies led to medical approval in several European countries. However, more recent American trials have shown less impressive results. The STEP trial, published in the New England Journal of Medicine in 2006, found no benefit over placebo. The CAMUS trial in 2011 similarly showed no significant improvement with Saw Palmetto. These negative trials challenge the earlier positive findings. Critics of the American studies point to methodological differences. The extract formulation, dosage, and patient selection differed from European research. Supporters of Saw Palmetto argue that the negative trials do not invalidate decades of positive European data. A Cochrane systematic review concluded that Saw Palmetto was not more effective than placebo for urinary symptoms. However, the reviewers acknowledged significant heterogeneity between studies. The current scientific consensus is uncertain. Saw Palmetto may work for some men, but not others. Individual response appears to vary significantly. Some researchers believe genetic factors influence who benefits from Saw Palmetto supplementation. Standardized Saw Palmetto extracts typically recommend doses of 160 milligrams twice daily. This totals 320 milligrams per day. Some products offer once daily 320 milligram formulations. Extracts should be standardized to contain 85 to 95% fatty acids and sterols. This standardization, often labeled as lipidosterolic extract, matches the formulation used in clinical research. Whole berry powders and teas contain much lower concentrations of active compounds. These products are unlikely to produce therapeutic effects. Effects may require 6 to 8 weeks of consistent use before becoming noticeable. Some men report benefits within a few weeks, while others need several months. Saw Palmetto is intended for long-term use. Discontinuing supplementation typically results in symptom return. The extract is fat-soluble, so taking it with meals improves absorption. Saw Palmetto has an excellent safety profile, based on decades of use and research. Side effects are generally mild and uncommon. The most frequent complaints include stomach discomfort, nausea, and headache. Taking the supplement with food usually minimizes digestive issues. Unlike pharmaceutical 5-alpha reductase inhibitors, Saw Palmetto rarely causes sexual side effects. This is a major reason many men prefer it to prescription alternatives. Studies have not shown significant effects on libido, erectile function, or ejaculation. However, some cautions apply. Saw Palmetto may have mild blood-thinning properties. Men taking anticoagulant medications should consult their physician before use. Discontinuing Saw Palmetto before surgery is advisable. Hormone-sensitive conditions require careful consideration. Because Saw Palmetto affects androgen metabolism, men with prostate cancer should avoid it unless approved by their oncologist. The same applies to other hormone-sensitive cancers. Women should generally avoid Saw Palmetto, particularly during pregnancy and breastfeeding. The anti-androgenic effects could theoretically affect fetal development. Children should not use Saw Palmetto supplements. Saw Palmetto is primarily used by adult men over age 40. This is when prostate enlargement typically begins causing symptoms. Men in their 50s, 60s, and beyond represent the core demographic. The supplement may be appropriate for men with mild to moderate urinary symptoms. Those with severe symptoms or suspected prostate cancer should seek medical evaluation first. Younger men sometimes use Saw Palmetto for hair loss prevention. The evidence is weaker for this application, and expectations should be modest. Women occasionally use Saw Palmetto for conditions related to androgen excess. Polycystic ovary syndrome and hormonal acne are sometimes cited. However, research in women is very limited. Any use by women should involve medical supervision. Adolescents and children should not use Saw Palmetto. The hormonal effects could interfere with normal development. Elderly men can safely use Saw Palmetto but should ensure they have had proper prostate evaluation. Symptoms of benign prostatic hyperplasia can overlap with prostate cancer. Self-treating without medical assessment could delay cancer diagnosis. Saw Palmetto occupies a complicated position in modern medicine. It is simultaneously one of the most popular herbal supplements and one of the most controversial. Millions of men swear by its effectiveness, yet major clinical trials have failed to confirm dramatic benefits. The truth likely lies somewhere between the enthusiasts and skeptics. Saw Palmetto is not a miracle cure for prostate problems. Men expecting dramatic improvement may be disappointed, but neither is it worthless. Many men experience meaningful symptom relief with minimal side effects. For some, it provides a satisfactory alternative to pharmaceutical medications. The key is realistic expectations. Saw Palmetto works best for mild symptoms in men who want to try natural options first. It should not replace proper medical evaluation. It should not be used instead of proven treatments for serious conditions. But as part of a comprehensive approach to men's health, it may have a legitimate role. The Native Americans who first used these berries understood something valuable. Modern science is still working to fully explain what they knew instinctively.